Hi, I'm Dr. Seiler again from Seiler Skin in Birmingham, Alabama, and we're going to shoot the second video here of the liquid facelift. We just completed the cheeks. You can see in a previous video on our website where we treated the cheeks. And she's really gotten a nice enhancement of her cheek here to help give her a better oval of her cheek and lift all through here with just one syringe of Voluma. So contrary to popular belief, you don't have to use a lot of filler to get a good result. She did all of that without a numbing shot. So we're going to do a little bit of filler now in what we call the nasolabial fold. She's really got good tissue here, so we're not going to have to do too much. And you can see that she's got good center portion of her lip, but we're going to do a little bit in the corners of her lip here, and then a little bit down here. We're also using my AccuVein to see if she's got any little vessels that might bleed if we hit them. So this will help me to see if I need to kind of change my angle or change my positioning. Okay. And again, she's had this before. Most patients I do a little numbing shot on, but she's actually doing this without any numbing at all. We just did a little bit of ice before. And ice really helps to minimize the risk of bruising, but it also helps with any minimal discomfort. And now that we've got the cheek good and lifted, we don't really have to put a lot of filler here. I'm going to try to kind of do this in only one or two little sticks. You can see she didn't bleed at all from that since we used our little AccuVein. Now that I know where the little blood vessels are, it really minimizes the risk of bruising. So, really want to shoot these videos even though it's probably a little hard to see the result on the video. It's more for the purpose of future patients to see that this can be done with little to no discomfort and really minimal if any bruising or bleeding. All right, let's ice her corner of her lip a little bit. We always do ice before to help kind of numb the area, but also to minimize the bleeding. And I was educating my staff earlier while we're icing, and the reason to do some filler in the cheek is that if you increase the oval of the cheek and give them a better angle, you're going to have a nice upside down triangle to the cheek. And it really helps to just lift the whole face. It doesn't make you look wider or fatter. But she's also a perfect candidate because she's got good volume in her cheek. If somebody's really thin, then it's a little bit more difficult to get them where they want to be with filler. But she got really good lifting with just a couple little sticks of Voluma out here. We only put half a syringe on each side, so I think she's going to be really happy with it. All right, let's take a look real quick. We'll look and see if we see any vessels on her lip, and we really don't. You would see a little dark line, but you don't see any right there, so we know we're safe to inject, okay? And the lip tends to be pretty vascular anyway, so you always kind of really take your time. People are also really afraid if they've never had it before. They're afraid to get their lips filled because they're afraid of it looking abnormal or too big, and my patients know that I do great lips. I really know right where to put the filler, and I never put too much. You can always put more in. You doing okay? Mm-hmm. You can see that with just a little bit of ice before, she really is tolerating this fine without any discomfort. The trick on the lips is to really put it in the right place. Most people put too much filler in the pulp or the bulk of the lip. And in most people, what you really need to do is put it more on the vermilion border right here to give them a little bit of a flip of their lip so that they're showing their own volume. I'm going to put just a little bit right there. And I still haven't even used half a syringe of Juvederm between her nasolabial area and her lip. She's had a little bit of filler in her lower mouth area and her lip area in the past, but most of this is her tissue. All right, so let's take a look again down here, see if we see any vessels. All right, let's come at a little bit different of an angle. Okay. All right, come off one. So now we're going to do just a little bit down here. This is a good area to put just a little bit of filler to give them a little bit of lift in the lower mouth so that you don't see the downturn of the corners of the mouth there. And you can see, with the exception of that tiny little bout of blood, which we're going to hold pressure right there, she's not bleeding at all, so she really shouldn't bruise. And it doesn't sound like it's too uncomfortable, so. Saw you wiggle a little bit with that last little lip shot, but it wasn't too bad, was it? Now, for the general population, for people that have not had this done before, people that are more sensitive, I do a numbing shot, and it makes it completely painless. But Miss Lee here is one of my girls here, and we've got patients this afternoon, so we're doing this before patients and trying to keep her from having to be numb to talk to patients. So we did it without any numbing, but it's totally easy for me to do a little numbing shot to make the lips completely numb, but I knew she wasn't going to need it. Trick to this is always to hold pressure until they stop bleeding. Most people that do injections are not going to hold enough pressure. So we're going to finish off her lips and her chin area, and we'll have some before and after pictures on the website. And like I said, the other video of doing her cheeks is also on the website. So thanks for watching. This is the liquid facelift at Seiler Skin.